31st of October and 2022, and already 10 months have passed. Let's give gratitude and thanks to Almighty that everybody is well, and let's pray for all those who we lost, and pray for the people who are in pain and suffering. Well, today's video is it's a happy video, because whenever there's happiness, I feel that we should make a video. So I'm making this in English. Who are we? Well, Amarjit Singh Narula, Shilpa Khedekar, my colleague, 12 years on Asta channel. That's me. We wrote this book, Wellness with Acupuncture and Colors. What colors? Markers. What do you do? On the hand, on various locations, you apply colors. So this one is toothache, black color around the nail. So if you have a toothache, you can apply black color around the skin on the nail. So this is a red marker. You have to use a black marker. So like that, 108 problems are mentioned in this book, and we can help you. The book can help you when medical science is unable, because supposing you are traveling in an aeroplane, you are on a journey in the jungle, and you have a toothache, and you don't have antibiotics or painkiller, and you are in pain. What do you do? Well, our book can help you. After that, you come back from your holiday, go to your dental surgeon, get it done. But at least at that moment, you can help, like loose motion, diarrhea, vomiting. Many cases where we've used this in an emergency, and people have really thanked us. So this is available. I'll give you the number in the end. Why am I making this video today? Well, this is about a case of a kidney problem. A gentleman from India in Singapore, 1963 born, diabetic for over 30 years, on insulin. So he had come to India for a consultation, Chennai, and he had called me in September. So he was referred to one of the cases in the book where we had helped a lady with a liver problem, and it's on page 166. That case is there. So she knew this gentleman, close family relationship. So she told this gentleman from Singapore that Amarjit Singh Narula and Shilpa ji help me with my liver. So why don't you try their treatment for your kidney problem? So since he had come to India in Chennai, so he called me and he discussed his case, and he was very stressed, tense. I mean, who wouldn't? If you've got a kidney problem and you're meeting doctors, and you would be stressed. So then I was traveling, I remember that day. Then the evening, around this time, 7:30, I called him and we had a talk. And we discussed a lot, and I told him how we work, our payment. He agreed to everything. So he said, I just want to talk to you. And we had a nice talk for 1.5 hours. And he said he was in Chennai, and it was around Tuesday when he called me, and he was coming to Aurangabad on after 8 days. So he says, when I get back to Aurangabad, my home is in Aurangabad, so I'll be going home to meet my extended family since I've come from Singapore to India. So I'll be with them for up to 5th of October. I said, great. So we discussed everything, and he sent me the reports. We discussed the money and aspect. He was ready. He said, no problem. Just let me come to Aurangabad, and then we'll fix up. So in the meantime, I had to go to Delhi, and my tickets had been booked. So I said, don't worry. My colleague Shilpa Khedekar, her name is here, Shilpa Khedekar, she would come to Aurangabad, and she would stay with you at your home with your family, and you would have to take care of her, and she'll come by flight, and you would have to pay everything. He accepted everything. They accepted everything. So then, in the meantime, me and my colleague in Bombay, we prepared all the treatment, because he was going to go back to Singapore on the 5th. So we planned that we would arrive in Aurangabad on the 29th From the 29th to the 3rd, we would be there. Not we, my colleague would be there. And within those 4 days, uh, in Aurangabad, my colleague would guide, treat, and show the treatment and do the treatment within those 4 5 days every day, so that he would be educated to continue his self treatment when he goes back to Singapore. Because he couldn't come to Bombay, he couldn't stay here. He needs food from home, right? Because of his diabetic issue, everything is controlled, so he doesn't want to get an infection. So I told him, come to Bombay. He said, no, I can't come to Bombay and stay in a hotel. I said, okay, then we can come to Aurangabad. He said, that's a good idea. So I said, okay, we will come to Aurangabad. So my colleague went there, and in our book we have written, many people question me, what method do you use, how do you use, what do you use, when do you use? Well, here it is. It is written on page 133. In this part of the book, we have included brief write-ups about various alternative healing method systems that we have learned and are using over the years since 1999, after I was able to overcome and cure myself of my long-standing severe ulcerative colitis after 13 years, ultimately using a combination of such systems together. So I solved my ulcerative colitis after 13 years of suffering in 1999. It took me 3 years to resolve it. From our experience, we have concluded that in any case, a combination of alternative therapies works better rather than a patient trying various therapies in isolation one after the other. Sustained efforts, both from the side of the practitioner and patient, and a positive attitude from patient side are also important factors that influence the effectiveness of the treatment, no matter how complex or uncurable health problems that you may be suffering from for a long period of time. What do we use? Acupressure, acupuncture, alkaline water, aromatherapy, auricular therapy, Bach flower remedy, biochemic salt, color therapy, diet, nutrition, energy healing, Reiki, handwriting analysis, mantras, meditation, mudra, time acupuncture, twist therapy, Vastu Shastra, geopathic stress, iTera care, frequency healing, radical healing, and so many methods. Cupping, dry and wet. Mostly dry. I don't like wet because bleeding takes place. I don't do it much. I really do it, although I have trained in it. So over 18 to 20 methods I have explained. I have not explained. I have listed out which we've listed here. So we've given 1 or 2 pages of each in this book. And in the end, we've got cases which we've treated which are very complex, and we've given the index. So the index is here with photographs, over 29 methods, 29 different complex cases I mentioned. Now, our friend, he's now like a family because when we connect to patients, they become family and we become family. So he said, you should come to Singapore for a holiday. I said, yes, definitely. Shilpa ji ko bhi bola that Shilpa madam, you also have to come to Singapore for a holiday, stay at my house. So we are grateful. Thank you so much. So someday we will go to Singapore. Now, he went on 5th, right? We are still in October today, 31st of October today. Okay? So now here are the results. Well, on 17th of June, then 30th of August, and 21st of October. I have his reports. There is no cheating. We will show you the original reports. If you want, we will remove his name, remove the hospital's name, and we will send you his reports. So don't worry, we are not going to cheat you. Urea was 10.8 on 17/6. On 30th of August, it was 18.4. Therapy treatment started on 30th 9 to 3:10. So 30th September till 3rd of October, my colleague was in Aurangabad. We have the aeroplane tickets that were paid for. So don't need to doubt us. We can prove it with our boarding pass. And we will also tell you which flight she flew. Okay. 21:10, he took the reports in Singapore. He went on the 5th. He's also got his reports. He's also got his flight details. He's got his passport when he went to Singapore. So no cheating. Urea is 14.7. Creatinine 413 on 17.6. On 38, 520. After on the 21st, 459. So 41 and 20. 61 points, it's come down. In India, it is in a 1.2, 1.3, 1.5 or 6. That is, in Singapore, they have a different method of tabulating it. So from 459, from 520, it has come down to 459. So that means if you take 520 and 61 points down, 41 and 20, 61, around 12% reduction in his creatinine. Anion, there is another test which I first time came to know. 16.7 on 17.6, on 38 it was 17.2. We started treatment between 39 and 310, and then he went to Singapore. Then there was Garba, so he missed that holiday. He missed a few days. He was telling us गरबा चल रहा है दिवाली के लिए, तो हम उसमें बिजी हो गए, हम ट्रीटमेंट नहीं कर पाए, कुछ नहीं होता, व्हाट्सएप पे थे, तो हमने बोला एंजॉय करो. वो भी एक आशीर्वाद है माता रानी का, वो भी किया और आशीर्वाद लिया. 14.7. तो 17.6 को 16.7 था, 21.10 को 14.7 हो गया एनआईएन. 28 को ये रिपोर्ट्स मेरे पास 24th को आए, और टाइम लगता है सिंगापुर में. 24, 25 को मुझे दिया. फिर उन्होंने बोला 28 को डॉक्टर को मिलने जा रहा हूँ, तो डॉक्टर को 28 को मिलने गए. एंड he sent me a message early morning on my mobile. I will read it to you because I feel that happiness is to be shared, not to be kept. So early morning, he sends me a message on my WhatsApp, because Singapore India timing 2 hours different. So he sent me a message and he was so happy that he told me that, sir, my doctor is so happy with the outcome of my reports. And I said that we on our part are so happy that you have benefited. Just a minute, let me read it to you. Okay. So he sent me a message early morning and he says, very good morning, sir. 28th October at 9 o'clock in the morning. He sends me, met my kidney doctor today. He was happy with my results. Thanks to both of you. Then he put all his reports and I said, congratulations, very happy recovery. At 10:36 I replied. So, this is from Singapore. This is his WhatsApp. I'm doing it on another one. So now, what does it show? It shows and it proves that your body is capable of helping you get well. आपकी बॉडी आपको मदद कर सकती है अगर आप एफर्ट और प्रॉपर आइडिया, प्रॉपर प्रोग्राम, प्रॉपर ट्रीटमेंट आपकी बॉडी को देंगे. आई एम रिपीटिंग इट इन इंग्लिश नाउ. योर बॉडी is capable of helping you to recover, provided you put in effort, provided you put in proper program and proper treatment to help your body to recover. It can be any problem, no problem. We do not give any guarantee, we do not give any assurance, we do not give any refunds. All these are clarified in writing before the treatment is given to the client. When we consult, we charge a consultation fees to discuss the case, to make the patient understand, and we do video calling for 1 to 2 hours, and once they realize what is good for them, they take the decision in their own interest to begin our treatment or no. It is their choice. उनकी choice है, हमारी choice नहीं है. मैं 13 years, I suffered with ulcerative colitis for 13 years. I was responsible for my life. I would go to hospitals, I would go to doctors, I would take medicine. When I would suffer, I would go back again. Did it for 13 years. I didn't demand, I didn't request any discount from any doctor in my life. I went to the best of doctors in Bombay suburbs, Bombay western suburbs, from Bandra to Juhu. All the topmost gastroenterologists I have consulted for my colitis. Now, what was the purpose of making this video? The purpose of making this video was to give you an idea that if a patient with kidney problem and the doctors had given him 6 months, how many? 6 months for transplant or start with dialysis in Singapore. When he was discussing it with me, I said, what have the doctors told you, sir? Because he was talking of guarantee and assurance. He said, sir, I said, did the doctors give you any guarantee or assurance? They said, no, sir. I said, but one assurance they've given you, that within 6 months you need to go for dialysis or transplant. He said, yes, sir. I said, let us give it, why don't you give it a try? It will cost money, it will cost effort, it will cost time. But are you willing to spend money? Number one. He said, yes. Because if I don't do it today, once I start with dialysis, I'll have to spend it on dialysis. And then I cannot go anywhere. So then I said, what is your choice? He says, transplant. I said, provided you get a timely kidney for transplant. And after getting a transplanted kidney, will that body accept the kidney or will the body reject the kidney? If it rejects it next morning, you are again on dialysis. And if the body accepts the kidney, you have to be on medication for quite some time. And then again that transplanted kidney within a few years, 4 to 5 years, will again die off. And then you'll need another kidney or dialysis. And then again you cannot go to work, you cannot enjoy life, you can't go out, then you have to be very careful, infection and all. And he said, yes, it makes sense. Let me give it a try. I said, yes, that is the spirit. Because when we try, we will succeed. If we don't try, how will we succeed? Right? So I told him, that is the best attitude. Let us try. Let us give it a shot. Let me put effort into my life. I remember I was discussing his symptoms and he said, sir, I went for a 4-kilometer walk and I didn't feel tired. No, I said, what about body fluid retention? They said nothing. So then he was not monitoring his urine output and water intake was limited, 1 liter. So I said, now please start monitoring. Measure your urine. So he measured the urine and he gave me a feedback. 20 ml was less. I said, that much we can just allow it to evaporate from the body through sweat. So I said 20 ml is nothing in 1 liter. So he said, yes, he's a highly educated gentleman. That is why he's been in Singapore for 40 years. And so he understood. He said, yes, it makes sense that since 20 ml is nothing, because when you are sweating or, eating food, so 20 ml will be absorbed by the body. And the balance, he was getting it into his bottle. So I said, it's a very good sign that your body is not retaining fluid. And it's very good that you are willing to try. He went to Singapore on the 5th. And he's in touch with me and my colleague Shilpa. And they are doing some weekly healing sessions, mind and matter. And he's very happy. And it also gives me and my colleague a lot of happiness when we get such cases. And we are always open for trying. And yes, it is a vocation for us. Yes, it is a challenge for us, but in challenges we succeed. And this all goes to our uh, training, our thought pattern, how we are able to understand, because we have understood over 20 different systems, me and Shilpa together. She does some, I do some, we don't do together. So I do acupuncture, she's also done acupuncture, she's done sujok, she's went to Russia for time acupuncture, she's done radical, she's done aroma, I've done bakfla, we've both done acupuncture, we've both done acupressure. So I've done Vastu, I've done graphology, I've done numerology. So we integrate together and we take responsibility for our cases, and we help them. How do you get in touch? Well, this is our number 919869036813, 9820685280. Numerology, healing and consultation. This is our book, 108 Problems, Treatment with Pens and Colors. Well, Holistic Healing Therapy Center from Mumbai. We offer treatment without medicine using a combination of alternative therapies. Diabetes, arthritis, spine disorders, asthma, paralysis, skin problems, muscular problems, digestive disorders, colitis. I had colitis. Kidney and liver problem. Also, one liver failure case recommending treatment to a kidney failure case. Isn't it happiness? High blood pressure, low blood pressure, ladies' problems, migraine, allergy, thyroid, hormonal imbalance, all types of joint pains, depression, and many more. We are using many alternative holistic healing methods along with your regular medication. Gradually, we can help you get better. Contact us for treatment and learning. So, we try our best. Now he's in Singapore, we add some treatment, we increase the treatment, we change the treatment, and this is how we are able to manage cases who are not physically present in Bombay, or even if they are in Bombay and far off, we help them from afar. So these are the parameters. You can take a screenshot and you can, there you are. You can take a screenshot with the dates. If you doubt me, email me, call me on my number, and I will give you the original reports. Because we don't want to leave anything on doubt now. Why should we leave anything on doubt? So I'll give you these reports of dates that I mentioned. So thank you very much. Stay well. God bless you. Enjoy life and make the best of it. Jai Hind.